Hello, I previously have made a video about neck and shoulder acupressure for neck and shoulder pain. So this is acupressure for neck pain. So it may seem like I'm doing the same thing twice, but I'm not. Because when patients say they have neck and shoulder pain, they're usually referring to a tightness of the trapezius muscle. The trapezius muscle is a Greek word that means tetrapedon, 4 legs. It means a table. It's kind of like a square, but slightly at an angle. So it attaches from, I can't show you on my back, but imagine this is on my back. It's like it attaches round about here, and then it spreads out like that. It's like a diamond shape. So when we become stressed, emotional, busy, it contracts. And when it contracts, it pulls the shoulders up and pulls the neck usually forward. My previous video is about shoulder pain, just shoulder pain, which usually means something to do with the joint. So this video is not about the joint, and the treatment is not exactly the same. So this is for stress-related neck and shoulder. I mean, it could just be the neck, but it often involves this muscle here. This is the most common muscle to tighten up with psychological stress. So, in Chinese medicine, we use points near the problem, but we also use points a bit further away from the problem, which surprises some people. But if we don't do that, the treatment is much less effective. So I will start with the points further away, just because they're easier to find, easier to explain, and then we'll move our way up. I think I'm only going to give 3 points. More points are possible. But if you're doing this yourself at home, you want to be doing it every day, every other day, and if I give you too many points, you'll become overwhelmed and you're more likely not to do it. So the first point is the famous point from Kung Fu movies. It's half of the distance between this knuckle, and if you lift your thumb up, you can kind of see a little shadow that appears here. A kind of ditch appears. When you touch it, you can feel it between the tendons and the bone. So put one finger there, put one finger there, and then half that distance. Half that distance. And press the point against the bone, because then you'll get strong feeling. You can also use your other hand to give leverage. 1. That's the far away point. Now we're going to get closer to the problem. 2. This is if you have shoulder, if you, not shoulder meaning this, but shoulder meaning this, if this is your main issue, this is the main point. So you could have a massage that addresses this whole area, but the center of the whole area, the key that unlocks the whole area is this point. Now, usually we find it on a patient by finding the C7 cervical, 7th cervical vertebra, neck spinal bone. I can't see that on myself, you can't see that on myself, and more importantly, you can't see it on yourself. So what I would do is imagine it. So somewhere where your throat, you see this shoulder, it's somewhere roughly where my throat is. So somewhere roughly between the throat and the tip of the shoulder, halfway. Do you see? Roughly halfway is roughly there. And then if you imagine, so I'll turn to the side. So if you see, there's a kind of a slope at the tip of it. If this is a mountain, you want to find it at the tip, at the highest point. It's there. So you can, halfway between here and here, kind of at the highest point. So you can put 2 fingers and kind of lean down on it that way. I think actually that is the only way if you're treating yourself. If someone else is doing it for you, they have other options, because they'll be behind you. If someone else is doing it for you, by all means get them to massage the whole area and then concentrate on that point. If you're doing it yourself, that's, I think, not that practical. You can try. But the point, if you go for the point, you'll unlock the area. And that's on both sides. 1, 2, halfway. There, just at the top. And when you have the right point, it's going to be very tender and may even make you jump. It may not, but if you feel around there, I think you'll know when you have the right point because it'll be very tender. So lastly, I left this till last because it's the hardest one to find in a way. So you have to do it by feeling. And I'm going to put in the description under the video the code numbers for the points. And so you'll be able to, if this explanation is unclear, I hope it's clear, but if it's unclear, you'll be able to put this in Google, the code number from the description, and find various diagrams which may help you locate the point. I think video is generally easier, but sometimes you need some help from a diagram. So, see, behind the ears, so we're going to do this by feeling, because if you do this for yourself, you can't see, you haven't got eyes in the back of your head, so you're going to have to do it by feeling. So, you can use maybe your middle fingers, you could also use your thumb. So what you do is, behind your ears, you feel around the base of your skull, quite close to behind your ears. It's not directly below, but it's a little bit back, and then the skull starts. As soon as you feel some bone, on me it's here, somewhere here, you can press there. That's good for neck pain too, that's a different point. But this point is a bit inwards. So probably if you go inwards, if you keep pressing, stay in contact with the base of your skull until your fingers meet in the middle. It's a distance of about that much. Press until your fingers meet in the middle, and then come about halfway out again. It's probably best if you do this with your thumb, because when you press it, these fingers are not quite strong enough. So take your thumb roughly under your ears. Feel the base of your skull, where the softness of the muscle of your neck meets the hardness of the bone of the base of the skull. And then feel your way inwards until your thumbs touch, and then come about halfway out again. And you may find it very tender, you probably will. Then do you see, you can use your fingers to hold onto your skull and kind of squeeze, support your thumbs as they push upwards against the bone. Upwards against the bone. So that's it, that's 3 points. To release neck and shoulder pain from emotional stress-related causes. Thank you, and I hope it helps.